This class is hosted by Healthy Horizons, the first company to offer comprehensive workplace motherroom services and lactation at work benefits at scale across North America. We support parents at work and at home. In addition to our workplace services, we have breastfeeding centers in the San Francisco Bay Area. Today, we have the opportunity to hear from two experts that have a combined 50 years of experience in nursing and nature for moms and babies. Sheila Janakos is our CEO of Healthy Horizons, a role to which she brings 30 years of experience in providing breastfeeding guidance and education. She earned a BS in Community Health Education from San Francisco State University and an M.P.H in Public Health Education from San Jose State University. She is an international board certified lactation consultant and a certified lactation educator. Pam Caldwell is a certified herbalist, fertility, pregnancy, birth, postpartum, and lactation specialist. She's an ordained minister, angel therapy practitioner, certified intuitive, certified professional spiritual teacher, and a Reiki master. Pam's passion is to empower birthing families and to help make this a magical time of life, the sacred event that it is meant to be. She is also the owner of Herblore. Today, we're going to cover Herbs 101, lactation care, other common issues, some of our favorites, and also address your questions. A couple of disclaimers before we start. This information is not approved by the FDA. This information does not and should not replace the advice of your doctor. Please make sure to consult your doctor prior to starting an herbal regimen. Don't take anything for increasing milk production until you see there's a problem. Taking herbs to increase production can lead to making too much milk, engorgement, plugged ducts, or mastitis. And herbs aren't guaranteed to work for everyone or work the same for everyone. Everyone's bodies are different and results may vary. This time, I'm going to turn it over to Pam and Sheila.
Hi, everybody. I'm Pam Caldwell, and as Jamila said, I've been an herbalist specializing in the childbearing year for about 25 years now. One of the first things that you should know about herbs is what the different forms that they come in. Tincture is a liquid extract of an herb. You can make a liquid extract of a herb combination known as a tea. They're very easy and convenient to take. You take the drops under your tongue and they go directly into your bloodstream and have a pretty direct action depending on the herb that you're taking. They do come in a little dropper bottle like you see. The little squeeze bulb on the top is standard on all of them. The dosage is known as a dropper full, and it's about how much the bulb can squeeze into the tube. It doesn't matter how long or how short the tube is, the dropper will give you a standard dose. The difference between a tea and a tincture is basically just that. You have the herb that you can make into a tea, which is brewed with water, or in a tincture, it is usually tinctured in apple cider vinegar, vegetable glycerin, or alcohol. Alcohol has the longest shelf life, and it has great preservative properties, whereas and has about a 10-year or more shelf life, and the other, the non-alcohol has 3 to 5 year shelf life. To make a tea, depending on what kind of an herb it is, if it's a leafy herb, you boil the water first, put your herb in the water, take it off the heat, and just let it steep. If you're working with roots or berries or seeds, you need to put the herb in with the water and boil those. Otherwise, it will not release the medicinal properties. If you boil a leaf, it could ruin your tea. There are many herbs that help with lactation, and we're going to get into that here in a minute. That should be in the next slide that we go to. I think we're ready to go to that.
Okay, there we go.
Oh, yes, this is important, first of all. Do not take herbs while you're pregnant to prime the body for milk production. This is because these herbs are meant to start milk production. And if you do that too early, you can risk the all-important colostrum, which is the kind of clear yellowish fluid that comes out the first day from postpartum to day 3 typically. And that's really important because it lays down the beneficial gut bacteria for a baby's lifelong health. So you don't ever want to risk that. And with the herbs, you should see results in 3 hours or so, depending on the person, depending on the situation. So this is just not something that I recommend that you do. Wait until day 3 when the milk comes in. See if you even have a problem, because not everybody has a problem they think that they're going to. So they take herbs for increasing the production, but then that causes overproduction, which leads to a whole other host of problems that you want to avoid. So wait to see if you have a problem before starting anything. These are the top herbs that I recommend for increasing milk supply. Goat's rue is a great one for women who have trouble with milk supply right from the beginning, or those with IGT, insufficient glandular tissue, or who've had breast reduction surgeries or any kind of breast surgery. It works on the mammary glands themselves and is really fantastic for increasing milk production in these moms who have some breast issues. Moringa is highly nutritive. It's full of many, many vitamins and minerals. It's great for people who are malnourished. It's known as a superfood around the world, and it does help. It helps with breast milk production, plus it's really good for the immune system. Shatavari is an Ayurvedic herb, and it increases fluids in the body. So it's really good for increasing breast milk production. It's great for women who are nursing and want to start trying to conceive the next baby, because it helps nourish. It's a great reproductive tonic, this herb. It is known as herbal domperidone. Domperidone is a prescription medication that is used to increase milk production, but as with many prescription medications, it comes with its share of side effects. Shatavari does the same job without the side effects. Blessed thistle is another great herb. It is also a wonderful digestive tonic. It's known as a bitter. When fenugreek is one of the most popular and well-known herbs for increasing milk production, but not everybody gets results from it. So for those women, blessed thistle seems to work really well for them. Fennel is another great one. It not only helps increase milk production, but it helps to dispel gas, colic, reflux, indigestion. It's really good for all of those type of situations. I had a mom email in the other day saying that fennel was causing her gas, but actually what it does is it helps to move the gas out. So there might be a little fartiness, but that's okay. As long as the gas is moving out and not trapped inside and painful, that's the most important thing. And then, as I mentioned, fenugreek is probably one of the most well-known herbs for increasing milk production. But there's some things about this herb that you need to use or that you need to know when using it. Fenugreek can cause gas in mom or baby. It's pretty famous for doing that. That's why using fennel along with it can help keep that gas moving out. Fenugreek also needs to be used with consistency and regularity. It's like fenugreek acts in the body like turning on the faucet of breast milk production when you're taking it. And when you don't take it or skip a dose or just forget to take it, it can turn the faucet of milk production off. So this is super important. You want to be very consistent with your fenugreek dose and very regular with it. Don't just stop it all of a sudden, because that can drop your supply. You also want to be sure and read the labels of any products that you're taking, combination products, because many times they will include fenugreek. And when it's in a combination, it's almost impossible to regulate how much you're getting per dose. One bag of tea might have 2 seeds in it, another might have 11, another might have 7. And we see a lot of women with this up and down milk production, and it's because they're using a product that has fenugreek, and they're getting an up and down intake of this herb. So we find that when they use fenugreek all by itself, so that it's easy to regulate, they do much better and get much better results. So one of the main things I want you to remember from this webinar today is just read your label and see if it's got fenugreek in it or not. And, you know, just read the label, and, you know, that'll tell you, you know, what you need to know about using a product such as that. Again, you can use fenugreek, just use it all by itself. You can add other things to it, like goat's rue or fennel, in particular fennel, and that should do a really good job for you. I'm talking here generally. This is what I commonly see, but every woman's body is different. Some do fine with that. Some have their milk supply go away altogether, and some just have the up and down. So just something to be aware of. Herbs that I don't recommend that you use are borage and hops. Both do have the capability of increasing milk production, but borage can be rather hard on the liver. I don't recommend it at all. Hops, this is why women drink beer, you know, have a beer when they're breastfeeding, is the hops. And it's mostly the beer that is over in Europe, Germany, you know, they've got the nice thick beer with the hops. And that's why it helps increase their milk production. But hops can also be a depressant, and nobody needs that. So just be aware of that. Should you choose to use either one of those herbs, I really don't recommend it. Those are the main herbs that I really like and have done great work in increasing milk production in the clients that I work with, and for myself too when I was breastfeeding. I had the chance to try these on myself.
Pam, I really appreciate you talking about the hops and the beer, because that's probably one of our #1 calls. People are being told to drink beer. So
Right.
thank you so much for bringing that up. And alcohol also is a depressant. So putting those two things together, I think, is important.
Absolutely. Absolutely. So there are herbs. Some women make too much milk, and for those moms, I recommend sage and parsley. Sage in particular is quite strong and effective at decreasing milk supply. This is helpful for weaning, in cases of fetal demise, overproduction when it's leading to plugged ducts or mastitis. You can kind of tailor the intake of sage to the situation. If someone wants to wean and be done with their milk supply, then they'll want to go a little heavier. If they're wanting to just curb the supply, then start low with the intake and go up. I had a client one time who had her Thanksgiving turkey or Thanksgiving stuffing with the turkey, and this amount of sage in the stuffing was enough to decrease her supply. So it's a pretty effective herb for that. And parsley as well. I would say sage #1, parsley #2. And as far as uneven production between breasts, unfortunately, it's not possible to take an herb and have it apply to one breast and not the other. It's going to apply the action equally. I would recommend, if you want to increase the supply on one breast, nurse or pump on that side more often. And just keep in mind, if you have uneven production and you are unable to correct it, twins get one breast apiece, so your baby is still going to get milk. So don't worry. Plugged ducts. Plugged ducts can come from a variety of different sources. Most often it's overproduction of milk. Excuse me. So there's several suggestions. Where the plug is, you'll be able to tell where it is because there might be a little knot. It's going to be red and it's going to be sore to the touch. So I recommend putting a hot compress to the area before you put the baby to the breast. Breast milk can coagulate and harden just like melted butter hardens when it's cold. Breast milk, if it's sat in the breast too long in the ducts, it can harden like that as well. So if you put a hot compress to the area, it kind of melts that plug. And if you point the baby's chin towards the plug, that will give extra drawing action. It might be a little bit of baby acrobatics, but that does help. And I know it hurts, it's painful, but it's really important that you continue to nurse and get that milk out of the breast. Otherwise, it could turn into mastitis, and nobody wants that. There is a health supplement called lecithin, might also be known as soya lecithin. Lecithin is a emulsifier. They put it in chocolate to keep it nice and smooth and creamy, and it does the same thing to breast milk. It'll help keep it smooth, and it will help prevent it from creating plugs. When I was breastfeeding, I was getting a plug every 3 weeks until I learned about lecithin, started taking that, and once I found the right amount for me, I had no more plugs, no more mastitis, and I nursed my baby till she was 3 years old. Poke root is also another helpful, this one is an herb. It's a powerful herb, so you just need a little bit, maybe 2 to 4 drops in the morning and then again at night. You should see results within 24 hours, and it will help clear the plugs. This herb also is appropriate for mastitis. It will help, in most cases, clear mastitis within 24 hours without the need for antibiotics for most people. Again, everybody's experience is different, and if you feel you need to step up to something a little more aggressive like antibiotics, please follow your guidance and your intuition on that. Mastitis tends to happen to women who are doing too much and extending themselves. So you need to rest. Just take your baby to bed with you, rest, breastfeed, call somebody in to help take care of other kids, housework, whatever needs to do. You just need to rest. Listen to your body. And of course, poke root, and then echinacea is also another really wonderful herb for helping get the immune system woken up and go and help fight any infection that might be in the body. You can take both together. And echinacea, you might want to take 2 dropperfuls, which is a squeeze again, every 2 hours for the first couple of days at least, until the acute phase has passed on the poke root or on the mastitis. And you can use poke root for 2 to 4 drops morning, and the same in the evening for no more than 5 days. And then again, lecithin, if it's caused by plucked ducts, that works miracles, and you can take it long term. It's very healthy for the brain and the liver.
Pam, I'd like to just add something about the lecithin. For people who have soy issues or allergies, they could also do sunflower lecithin. So it does come in other forms, which is helpful now.
That's
and then
true.
I wanted just to pop back to the part on the hot compresses. The other thing about hot compresses, it does help like increase circulation. It helps open up those ducts, dilate them. The reason why I had added ice after, and that is after the feeding, is because with the plug duct, you're going to get a lot of inflammation. And we want to reduce that inflammation in surrounding tissue.
Yes.
So the ice is really important to help with that. And the same thing with mastitis. So after the feeding, we'd want a person to use the ice packs to really reduce that inflammation.
That's very, very good points. Very true. Thanks, Sheila. Okay. Thrush is a yeast infection of the breast, and it's no fun. It typically happens when moms have had a round of antibiotics, because antibiotics will go in and kill both the bad bacteria that's causing the infection as well as the good bacteria that our bodies need for good digestion and health. The biggest thing to know about thrush is that you need to eliminate sugar. Sugar feeds that yeast organism and causes it to just proliferate. If you don't stop feeding it, you're going to have a much harder time killing off this organism. So that's a big thing. And I know it's hard to go off of sugar. The cravings last a couple of days, and it is not forever. It's just until you get this yeast under control. As far as a treatment, you can use apple cider vinegar. You use 1 cup of water to 1 tablespoon of apple cider vinegar, and you can either pour it over your nipple, or you can put it in a shot glass and put the shot glass over your nipples to let it soak there a little bit. Then you take that off, and then you can apply some plain yogurt with the active cultures, because those the probiotics that are in yogurt will help replenish the bacteria that's being killed off, the yeast bacteria that's being killed off. Let your breasts air dry as much as possible. Get that air there to them. Just like with any yeast, if it's, you know, trapped in clothing or anything sweaty, it's going to make it also proliferate. Deodorized garlic is a great herb. Garlic is also works as a natural antibiotic, and if you get, and it's really great against fungus like yeast. You can get deodorized garlic, which cuts down on the smell, and it also cuts down on the garlic taste that might come through your breast milk, because some babies are fine with that taste in the milk, and some babies don't like it. With using deodorized garlic, it kind of takes that off the table. And really important is for you to take probiotics, which will help replenish the beneficial bacteria to your gut. And, you know, especially if you've had antibiotics, that's all been wiped out, so you want to replenish that. For babies, because it's important that both mom and the baby get treated, because they can just pass it back and forth if they don't treat both. The babies will get like some white patches on the inside of their mouth that you can't wipe off. Typically they don't have any pain with it, but that's a sign that a lot of babies will get. For them, you can use a non-dairy acidophilus liquid to wipe on the inside of their mouths. And I know Sheila carries baby jarrow. Maybe Sheila, you can talk a bit more about that, because when you told me about it the other day, it sounded great.
What we like about the baby jarrow, it just has 1 strain of bacteria, the Infantitis bifidus, which is what is found in breast milk, but also in the baby's gut, and it helps replenish that, because again, if there's an imbalance, then we're going to have the yeast kind of overgrowth and not enough of the good bacteria, especially if maybe the mom had maybe antibiotics, maybe she had a cesarean, or she was group B strep positive, something during the delivery that kind of caused the floor to kind of get off balance. That baby already comes to the table with kind of a little disproportionate amount of the good bacteria. So we really like the jarrow.
Yeah, that sounds great. And you can swab the inside of the baby's mouth with the plain yogurt to address the white patches in the mouth. And for a lot of times, baby will have a diaper rash that's hard to get rid of. And if you use a tablespoon of baking soda to a cup of water as a wash for the diaper area, that really helps. Do you have anything?
And Pam, some people also use the baking soda rinse on their nipples too. You just would want to make sure that you rinse it with warm water before you feed the baby because of the sodium content.
Yes. So some other mommy trials and tribulations might be depression. And this is very common. Not only are you having hormone fluctuations, which, any of us who've had PMS know that can definitely result in depression. Add no sleep, maybe some isolation. There are a number of factors. The thing is, you want to reach out and get help right away. It doesn't get better typically until you do something to make it better. So seek out help. There are therapists, there are new moms groups, there are breastfeeding groups. Just, get some community so that you can connect with other people who are going through the same thing. It's very validating to know that you're not the only one going through this. It's other people too, and what have they done to help themselves. So community is very important. Please do reach out. As far as herbs, St. John's wort is helpful. It's safe to use during lactation. It is not okay to use during pregnancy. It should not be used in conjunction with medications for depression. We've developed a Happy Day tincture specifically for pregnant and breastfeeding moms, which is safe for both pregnancy and breastfeeding, and it is safe for those who are on medications. It's a simple tincture with many flower essences in it, which is called vibrational medicine. So it doesn't interact with any other medications. Lack of sex drive is another thing that moms find. And, our bodies are being pulled and nourishing babies and being touched, and it's not surprising that there's a lack of sex drive. Sleep deprivation, overwork, we're just spent, and there's just really nothing left a lot of times. Hormone imbalance can lead to that. Also, I have the belief that it's nature's way of ensuring that there's only one baby at a time, because the survival of the first baby needs to be assured before the next baby comes along. That's just my opinion, what I feel, but it's a tough thing to go through. Vitex is an herb that you can use during breastfeeding that will help with hormone balance, which may help bring back the sex drive. It is perfectly safe to use while breastfeeding. It can bring back the period. If you haven't gotten your period yet, it can bring it back. But it really does help with hormonal imbalance, which in turn helps with feeling like wanting to get sexy. So on to hormonal imbalance, there's the Vitex there. Shatavari also is really wonderful for as a reproductive tonic, as I spoke about earlier. It also helps increase milk production. So if you are, again, a nursing mom who's thinking about their next baby, Shatavari is a fantastic herb for you. It will help get your body prepared for conception while you're still supporting the breast milk production for the baby. Commonly, babies have gas, colic, reflux, indigestion. The simple fact is their digestive systems are still immature, and they're maturing, daily as they grow. By the time they're about 6 months old, their systems can handle more than just breast milk or formula if you need to do that a little bit. But in the meantime, there are herbs that will help with all of these things: gas, colic, reflux. Tummy tincture is something that we developed that has a number of different herbs that are helpful for the tummy and very gentle. Fennel, chamomile, the dill. There's a whole list that I can't really remember what all's in it right now, but it works really great for all of the gas, colic, reflux. If the baby's young, I recommend that the mom takes the herbs, and it will pass to the baby through the breast milk. If the baby's in acute pain, you can give a couple of drops directly to them. Every once in a while is not going to hurt anything. Be sure to get a non-alcohol version of the tincture, though, because the alcohol wouldn't be harmful, but they would just hate it. Tummy massage is also really good. Sheila, maybe you can speak to that a little more directly.
Absolutely. If you're going to do tummy massage, what I would recommend is doing maybe something like a coconut oil that you could warm up in your hand. You don't want to ever put something cold on the baby's tummy. And you're always going to work clockwise because that's the direction that the gas needs to move. There's some great videos online on YouTube, and there's a video called "Oh Baby 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 Massage," and I think it's on the Lamaze site if you ever go to look at that, and it really shows how to do it. But it does help move the gas out and make babies much more comfortable. After doing massage, after a couple weeks, babies tend to like start to look forward to it. You can even put your hands up. Always ask permission first, and then when you do the massage, you'll even hear the gas moving and some farting, as Pam was talking about earlier. So I can't talk. I mean, it's the best thing you could probably do for your baby when they're dealing with this. So we have some really great products that do contain a lot of these herbs. We have been using herb lore tinctures and teas for, I'm going to say, Pam, correct me, at least 15 years?
At least 15, if not more.
Yeah, a long time. We have tried other products before that and during that, and we always go back to herb lore because it's consistent. They're clean products, and we feel like we get the good support that we need if we have questions. So Pam, thank you for such an awesome product.
Thank you,
We
Sheila.
really appreciate that. For moms who are looking for treats, there's the Milk Makers cookies, and they also make a tea. And a lot of the lactation rooms that we service will stock these to help their mommies have a little treat during the day and have some tea to help with their milk production. Traditional medicinal teas you've probably heard of because they do like the sore throat teas and all the other teas. Those are also a nice staple to have, and a lot of our lactation rooms also stock these. I think one of the reasons why some of these other teas are so helpful is it helps the mom remember to drink. It keeps her hydrated, and I think also drinking something warm helps reduce stress. So I think there's a lot of reasons aside from the medicinal parts of this. Another product that we've had a lot of luck with is Mrs. Patel's. They make these bars that are fresh. They do need to stay refrigerated, but their bars, their cookies, and their teas are always, they're very, very rich flavored, and they have a lot of the fenugreek. So again, when we're talking about the fenugreek, you're going to heed Pam's warnings. You don't want to do it some days and not be consistent with that.
Yeah.
For the overproduction, we carry Pam's teas. I do think that drinking teas are probably the easiest things for moms to do when they're dealing with that. Because I know that's the stressful thing. People think like, why would I ever want to reduce my milk production? But there are plenty of reasons. We also use the Earth Mama No More Milk Tea. That one has the sage in it and some peppermint. But I know that the sage is probably what you would recommend the most, correct, Pam?
Correct. Right.
Yeah.
And peppermint also can lower milk production, but it's mostly the essential oil, which is very concentrated.
Right.
So a little bit for the herb, but not so much. It's mostly the essential oil.
Thank you.
Yeah. That's a nice tea, though.
And the next slide, we're going to talk just a little bit about some of the foods. I'm not going to go into graphic detail, but like one of the reasons why I put this list up is because part of having a good milk production is working on your immune system and keeping your energy level up and your stress down and nurturing your body with really wholesome powerhouse foods can really help with breastfeeding. Avocados is probably my favorite food because it's so high in the good fats, and it really helps a mom with satiety. We do know that those fatty acids are important, and we want to make the right fatty acids for our breast milk, so nourishing our body is going to be important. The nuts, with the protein and the fatty acids, when we look at the beans and legumes, like one of the ones that really comes to mind is like the chickpeas. In many cultures, they use that as a galactagogue, which means it helps produce milk. So just having those in your diet could be really helpful. Mushrooms, like why would mushrooms be helpful? Well, mushrooms actually have something called beta glucans. And those are the same compounds that are actually found in oats and barley, which also have been linked to helping with milk production. So you could, cook up your food with mushrooms and help out. The rest of these all will help in different ways, but I do want to, the ashwagandha is an herb, and Pam probably has more information about that. But one of the reasons why a lot of my moms will make these smoothies and they'll do coconut milk, because coconut also has those good fatty acids, and they'll add some turmeric and maybe a pinch of ashwagandha for the reason that it helps reduce stress. And when you have those stress levels high, that can also impact on milk production. So this is just a little list for your own purview. And I think that just combining these foods in your diet in general would be really healthy for you.
So some common herbs to avoid. Let me start off that we have a whole list of herbs to avoid during pregnancy and breastfeeding. And I think, Sheila, you have that up on your website.
Yeah, we have it on our blog. We wanted to really make sure that, because it's so extensive and wonderful, we wanted to make sure people had access to that.
Right, because regular herbalism is different for pregnant and breastfeeding moms. What is fine for regular people or people who aren't pregnant or breastfeeding can be not good or even harmful to a pregnant or breastfeeding mom or her baby. So there's some that really stand out to me that are common, and that is kelp or seaweed. Some women will take this for low thyroid. But it can cause emaciation or weight loss in the baby. So this is not recommended. Kratom is an herb that is becoming more popular these days. It's for helping people get off of addiction. It is for pain relief, but it acts like an opiate in the system, and it's just completely inappropriate and not safe for pregnant or breastfeeding moms. Cannabis is another herb that is becoming more popular and widespread these days. It's a great herb and it does many amazing things, but research does show that it depresses babies' nervous systems. And I just don't feel comfortable enough with it right now to recommend it for either a pregnant or breastfeeding mom. There's plenty of time after you're done breastfeeding that you can take advantage of its properties, but this is not the time. And again, please do refer to the list on Healthy Horizons blog. We have it's not a completely comprehensive list, but it's a pretty extensive list of herbs to avoid during pregnancy and breastfeeding. And with that information, excuse me, you can read your labels of your different products that you're interested in and know if it's safe and appropriate for you or not.
And then we also wanted just to discuss, if you are having underlying issues, we want to make sure we get to the bottom of what's going on. So if you're dealing with chronic yeast or mastitis, it is really helpful to work with a lactation consultant. They can help maybe educate you in conjunction with an herbalist like Pam to help you figure out what the right resources would be. Also, a lactation consultant, one of our jobs is to help create this comprehensive, consistent plan to help you follow in your breastfeeding. So if you're dealing with something like mastitis, we would be working on latch and positioning, your overall health. We maybe would have some herbals. If we need to be working with your doctor, we'll be working with your doctor. It's a comprehensive plan that would allow the lactation consultant and the healthcare providers to make sure you're really being taken care of. We look at this as more of a holistic journey, and we really want to make sure that we're just not piecemealing things together. And as a lactation consultant, part of what we do is like acting like a private detective. We have to gather all the information and then look at the specific issue and then help you formulate something. So I know that with Dr. Google out there, it's really easy to get online and just Google something, but you're not going to get the whole picture looked at. So I would recommend, if you're really dealing with one of these things, get the appropriate help.
So, Pam and Sheila, we've had a couple of people throughout this webinar send over a couple of questions that I wanted to pose to you all so you all can see them. So, one of the first ones that we had somebody ask is, how much fenugreek can we use?
I'm sorry, how much fenugreek can we use?
Yes.
Well, you can go quite high. Everybody's body is a little different. The highest I've ever had a client go is 21 capsules 3 times a day. That's like really high. And, she had some pretty serious extenuating circumstances, death in her family, all kinds of things. So she, she was really struggling. I don't recommend that much with grams of fenugreek. It can lower blood sugar. So that's something to keep in mind, but it does take grams of it to have that effect. It's really a matter of what is working for you. For me, when I used it when I was breastfeeding, 7 capsules 3 times a day did the trick. And that actually caused me to overproduce a little bit. So you just back off on it until you find the right balance for yourself. Fenugreek can cause gas, diarrhea in some rare instances. So if that happens, maybe it's not the right herb for you and you should gradually wean down from it so it doesn't drop production, and use something else as you ramp up on something else while you're weaning down from the fenugreek. So there's no real set amount of, this is too much. It's a matter of how it's resulting in your own body.
And Pam, just one question about that is, I do know that some of it will have 610 milligrams and some will have 400 milligrams.
Mm-hmm.
So you also want to probably look at the dosage also, correct?
Right, and the milligrams are only the weight of the herb that's being used. It doesn't speak to the quality or the freshness. It just speaks to the weight of the herb that was used to make that particular product. So that is a factor, but also more of a factor, in my opinion, is how fresh is this herb? Has it sat on a warehouse shelf for a couple of years before it gets to you, to your grocer, and then ultimately to you? You can tell when an herb is fresh by looking at it. If it has like a vibrant color, if you can smell it, if you have a fenugreek capsule and you open it, does it smell? Fenugreek smells like maple syrup. When it's in your system, going through your system, you might notice a maple syrup smell about you, and that's the fenugreek in your system. So, there are, looking at it, how does it look? Is it vibrant? Can you smell it? Does it just feel like it's a fresh herb? That's the most important factor in using herbal products and how well they're going to work for you. An old herb isn't going to hurt you. An expired herb isn't going to hurt you. It's just not going to work as well. Just like your cooking spices, if you have an old one, it's not going to give you the same results as if you were using a fresh one.
Thank you.
So the next question is, do you use lecithin when there is already a plug duct, or can you use it prior to getting a plug duct?
I would say either one. If you are getting plug ducts or you've had them in the past, I would definitely recommend lecithin. You can use it as a preventative. There's nothing wrong with that. But, my philosophy is if it ain't broke, don't fix it. I don't think it really matters one way or the other. Personal preference. What do you think, Sheila?
I agree. I do have some moms who've had maybe a bad history with lots of plug ducts and mastitis and really want to do that. But otherwise, I tell people, let's just wait and see. So I'm on the same page.
Yeah.
Okay. Somebody asked, can I take herb lore, goat's root, and nursing tea together?
Absolutely. Absolutely. The worst case scenario would be making too much milk. And if that happens, then you just cut down on it a little bit. Everybody's body is different. The results are going to be different. So feel free to experiment around and find what works best for you. The only one that I don't recommend experimenting dosage with is fenugreek because it has that consistency issue.
Okay. Do chickpeas cause the baby to get gassy? I felt like my baby was more fussy when I ate chickpeas.
Sheila, do you want to take this, or do you?
I would love to take this. Um, if a food causes you gas, the gas causing properties are not going to pass through to the baby. But your baby had some sort of reaction to actually the proteins in that. So I would be back off for a while and then try reintroducing that in maybe a month and just see what happens. If you feel like there is gas happening, then I would maybe try the fennel yourself, like drinking the tea and seeing if that helps. But I really think that most of the gas causing foods that affect people who are adults is not going to go through our breast milk. So that's the good news. Otherwise, we're kind of limited to what we eat. Dairy probably is the biggest culprit, and Pam and I have had many discussions on that. I mean, that's a big protein. It passes right through, and that can cause a baby a lot of GI distress.
Mm-hmm.
Okay.
And pay attention, if I could add something, pay attention to your baby, and notice what might make him or her gassy, and just because everybody can have sensitivities to different things.
Correct.
Okay. I have heard of a doctor recommending cannabis for pain relief during labor as an alternative to fentanyl or morphine. Thoughts?
Well, my opinion, if you use it once, it's not going to be a too terribly big deal. It's more on a consistent basis that it can have those depressive properties to it. But again, during labor and birth, oxygen is a really big deal. And if you're taking in smoke, that's going to cut down on your oxygen levels as well as your baby's oxygen levels. So I really don't recommend it, although, I'm not a big fan of fentanyl and those other things either. What do you think, Sheila? What's your opinion?
I would think if it is just during labor and it's maybe administered, whether it's, I don't know, like a cream or a salve or an edible, and your doctor's recommending it, that's probably, fine. We wouldn't have people doing fentanyl every day on their pregnancy either.
Mm-hmm.
So it's like a one-time thing. So I agree. I wouldn't think the smoking would be a good idea. I do agree about the oxygen, but I think if you were doing it in other ways and your doctor suggested it was that one time,
Mm-hmm.
go for it.
Right. And keep in mind, that's a good point, that you don't have to smoke it. There's tinctures, there's edibles, and if you do those things, they can last for many hours. So just, know your body, know how it affects you, and just, find the balance. But again, a one-time thing isn't going to have a huge impact on the baby's nervous system.
Okay. The next question is, if you've dropped production, is there a way to bring it back up even at the 6-month mark?
Oh gosh, absolutely. I work with moms who have adopted babies and have established a milk supply for their adopted babies. So there is no time limit. You can use the herbs along with pumping and bring your production right back up.
Okay.
It's never too late.
What would you recommend for moms who are suffering from nausea or, and bear with me, hyperemesis?
Yeah,
Emesis.
hyperemesis.
Yes.
Thank you.
Yeah, there are definitely herbs that can be used for that. Ginger is a really great one. You want to be careful and not use too much. One, because it's spicy. Another one, because ginger focuses energy to the pelvic region. So for people who might be a little sensitive to that, it could kind of stir up the uterus a little bit and maybe even cause some contractions. So just go easy on it. We developed a tincture called nausea relief tincture, specific for pregnant women and women with hyperemesis. It's perfectly safe for use during pregnancy. It was formulated for that. And it can be used for any type of nausea, but it's real effective. Morning sickness and pregnancy nausea can be a very fickle thing. What works one day might not work the next, but then it'll work again the next day. So, it's a difficult wave to ride sometimes, but that definitely does help.
And I'd like to add one thing about that product. So we have people come in and get it all the time who aren't even pregnant, who have nausea for other reasons. I've had people had family members who are dealing with the side effects from chemotherapy. So it's a wonderful product, and I think it's like something people should have in their medicine cabinet.
Oh,
Works really well.
great. That's great. Yeah, we people get it for kids with car sickness too.
Right.
Yeah.
Yeah.
Okay. So the next one is, which is the first herb you'd recommend to increase production? Goat's rue or moringa, or goat's rue and moringa versus fenugreek? I seem to remember hearing fenugreek isn't the first recommendation.
It's not my first recommendation because it does have that very well-known factor of causing really painful gas for some people. And it's a pretty strong herb, and you have to be very consistent with its use. It's a little more difficult to use than the others. If a mom is newly postpartum, she's just given birth, I recommend the nursing tea or tincture moringa blend. It has fennel in it, which is great at increasing milk production, super easy on baby's tummy. And it also has red raspberry leaf, which will help with mom's postpartum recovery. It's really high in vitamins and minerals, and it's a really great one to start with. For women who find that they've had problems with milk production right from the start, then goat's rue would be appropriate. And she can use goat's rue and the nursing tincture moringa blend together. Those are my two top ones to start with.
Okay. Are there any negative effects from jumping between different herbs to increase milk production, like moringa to goat's rue to shatavari? And for moringa, goat's rue, and shatavari, do you take it till your milk production is at the state you want it, or do some people continue taking it like fenugreek?
There's no problem with trying different herbs and seeing what works best for you. No problem with jumping around at all. Fenugreek is the only one that you should never do that with because of the reasons I've already outlined. Find what works best for you, and you might want to stick with it just to keep your life a little more simple rather than jumping around all over the place. And once your supply is where you want it to be, then you can discontinue and your supply should stay fine. With fenugreek, you do want to wean down slowly from that so it doesn't affect your supply. Some women do choose to or find that they need to continue using the herbs the whole time they're breastfeeding, and that's just fine to do. None of them, they're all very gentle. They're all very nutritive. There's nothing wrong with using them long term if somebody chooses to do that.
I think we've got time for one to two more questions. One that just came over is, are there any tips for moms exclusively pumping because baby doesn't want to latch?
Say that again?
Are there any tips that you all can offer for moms that are exclusively pumping because the baby does not want to latch?
Go, Sheila.
Well, I'll start and you can finish. How about that? Okay. Well, the first thing I would say is I would work with a lactation consultant to see if maybe you could figure out what's going on if you're choosing to have that baby to the breast. There might be something like a tongue tie or something else going on. But if truly there is the baby's inability to latch, most babies end up latching within a couple weeks. Some can take a couple months. But if a mom is exclusively pumping, she needs to be consistent. And I think that's like the main thing I would say. She needs to start off pumping at least 8 times in 24 hours. Some of the pumping sessions can be close together, but she needs to have at least 8 because it's all about keeping that hormone level up. When she establishes her milk production, if she stays exclusively pumping, a lot of moms do drop their number of pumping sessions, but not during the first 3 months. And then they'll kind of figure out what their overall volume needs to be. But consistency is probably the most important thing. And it doesn't mean getting on the pump and staying on the pump for an hour at a time. Short 10 to 20 minute sessions are more beneficial in keeping the hormone level up. Pam?
Oh, I agree. This is lactation consultant area. So I agree completely with what Sheila's saying. This is the time where consulting a lactation consultant is going to give you the information that you need, know what you're working with, and know how to work with it.
I think the one thing I would add too is that I would really start off with a hospital professional pump, the kind that you rent and the kind that are in hospitals, not the ones that you get through your insurance that are like the $200 pumps. You want to get something that's going to really be keep that hormone level up, be efficient, and have a really good suction curve. Be wary of pumps that actually advertise hospital grade. They're not. They could get as strong as maybe a hospital grade pump, but they're not going to have the suction curve. And if you're really doing exclusive pumping, we want to make sure we get off to a good start.
Okay. All right. So we have time for this very last question before we have to close it out. It says, is it true that goat's root is not recommended for diabetics, hypoglycemia, and fenugreek not good for cancers?
Well, goat's root also in high enough doses can lower blood sugar. So that is true as far as the diabetics goes, but it has to be high enough levels, and that's going to be different for every person. I recommend for both fenugreek and goat's root, if you're on a strict insulin regimen, that you carefully watch your blood sugar levels to make sure you don't go too low. And fenugreek contraindicated for cancer, I've never heard that.
Sorry, Pam. It was fennel seed not good for estrogenic cancers.
Oh, I see. I have my handy book here. I recommend this book highly, and it's very conservative. So I really like that. Let me just look it up. Fennel. It doesn't say anything about, oh wait. Oh, it's the essential oil. It says avoid prolonged use unless a physician is consulted. And this is a speculative finding, so it's not been proven. There's no cases of it. They just think that it might be a factor due to the pre-carcinogenic estradiol content of the essential oil. And again, the essential oil is a much, much more concentrated form of herbs than just having a cup of fennel tea. So I would say that I wouldn't worry too much about that unless you're taking high amounts every day for a long time.
Okay. So Pam, somebody just asked, what is that book called?
Oh, this is an awesome book. It's called, let's see, can you see that? Herbal Contraindications and Drug Interactions. And it's by Dr. Francis Brinker, ND. You can get it on Amazon.
Okay. That is an absolute perfect segue. I would like to thank everybody for attending this webinar today.